Trump's broken promise, no IVF mandate for insurers. In a surprising turn of events, the White House has decided not to enforce a mandate for health insurers to cover in vitro fertilization, IVF services, despite it being a cornerstone of President Donald Trump's campaign promises. This revelation comes from insiders familiar with the internal discussions, highlighting a significant shift from the president's public commitments. During his campaign, Trump made a bold pledge to ensure that the government would either fund IVF services directly or require insurance companies to cover the treatment. This promise was particularly notable as it came amidst intense political scrutiny over abortion rights, following the Supreme Court's decision to overturn Roe v. Wade with the help of Trump's appointees. The government is going to pay for it, or we'll mandate your insurance company to pay for it, which is going to be great. We're going to do that, Trump declared in August 2024. We want to produce babies in this country, right? However, more than 6 months into the second term, the Trump administration has yet to propose any new federal subsidies to make IVF more accessible or affordable. Moreover, White House officials are reportedly stepping back from internal proposals to mandate IVF coverage for the approximately 50 million people enrolled in the Obamacare exchanges. This information comes from sources who spoke on the condition of anonymity to describe private conversations. A senior administration official, also speaking anonymously, emphasized that while expanding IVF access remains a top priority for Trump, the president cannot legally mandate IVF as an essential health benefit without congressional approval. It remains unclear whether the administration plans to push for such legislation, but mandating insurance coverage for IVF is currently off the table. Kalen Silverberg, an external advisor to the administration and a strong advocate for increased IVF access, revealed in an interview that the White House has recently inquired about a fertility approach that focuses on holistic health rather than advanced tools like IVF. Silverberg noted that implementing this approach alone would fall far short of Trump's original promises. A White House spokeswoman, Abigail Jackson, reaffirmed Trump's commitment to expanding IVF access. President Trump pledged to expand access to fertility treatments for Americans who are struggling to start families, Jackson stated. The administration is committed like none before it to using its authorities to deliver on this pledge. The situation underscores the internal divisions within the GOP regarding IVF coverage and federal family policies. Social conservatives, concerned about the nation's declining birth rates, have advocated for more aggressive government intervention to support mothers and childbirth, including new federal funding and protections. However, these efforts have faced resistance from traditional, free market voices within the party, who are wary of federal mandates or new spending initiatives. For instance, requiring the Affordable Care Act exchanges to cover IVF could lead insurance companies to raise premium costs, which could be politically damaging for the GOP ahead of the 2026 midterm elections. How do you do this without burdening health insurers? That's the key question they've been wrestling with, one of the people familiar with the discussion said. It appears for now that they're not going to go there. Shortly after taking office, Trump signed an executive order giving the White House Domestic Policy Council 90 days to present a list of policy recommendations for protecting IVF access and reducing out-of-pocket and health plan costs for IVF treatment. The order highlighted that IVF treatments can cost between $12,000 to $25,000 per cycle. Officials at the White House have considered requiring IVF to be classified as an essential health benefit under the Affordable Care Act, which would mandate insurers in the marketplace to cover it. This policy has been supported by groups like Americans for IVF, the American Society for Reproductive Medicine, and Democratic lawmakers such as Senator Tammy Duckworth, Representative Lauren Underwood of Illinois, and Senator Cory Booker of New Jersey. However, numerous conservative policy experts have raised objections. Avid Roy, founder of the Foundation for Research on Equal Opportunity, a think tank promoting free markets, warned that such a move could increase premiums by several percentage points for tens of millions of Americans on the exchanges as insurers absorb higher costs. Anytime you layer on something as an essential health benefit, it increases premiums, Roy explained. To whatever degree people are pushing back for that reason as a policy matter, that's always been the debate. Patrick T. Brown, a conservative who supports pro-family policy at